Regina Harrison, and I'm a student, and I am in Teaching Learning Strategies, Nursing 5309 at UT. And I'm going to be demonstrating the proper setup of Tidal CO2 monitoring, the system itself. And Travis is here from UTA, and he's going to be helping me. He's a student. So it takes a little bit of time to get everything started, but first of all, I wanted to let you know what equipment we use for that and where it's kept in our unit. We use the Atmostat CO2 sensor, and it comes in the black box, and we keep that at Harris Southwest in the clean utility room. In that box, we have the CO2 sensor cable, and then we also have the analyzer, and the module is kept to the side of that because it's just a standalone and it goes from room to room. So we're going to, Travis, first we're going to put the module into the track there, and you can hear it click. Okay, and then you get your cable, and you want to do yellow on yellow, and these are really expensive, so you want to really be careful. And this one is used for mainstream Tidal CO2 monitoring. So you have the gray right here that clips into the yellow, see the indentation. So you would clip it in and make sure it's all in, and you should see it pop up. Here it is, and you have to wait about 2 minutes for it to warm up. Travis, I was going to ask you, do you know what the normals for CO2, Tidal CO2 is?
35 to 45.
Okay. And with that, the Tidal CO2, why it's so important that you make sure you have the waveform on there. A number is great, but it's important that you know what the waveform is because that tells you a lot of what the patient's doing. The reason why we would like for you to do pulse oximetry and Tidal CO2 at the same time, do you know why we want to do that?
For oxygenation and ventilation?
Correct. The pulse oximetry measures O2 saturation, and that tells us oxygenation within the lungs and in the body system. And the Tidal CO2 is used to monitor ventilation. Do you know what type of patients we may use Tidal CO2 on?
No, I'm not sure, but can you tell me?
Sometimes we have patients come in from surgery, and they have been sedated quite a bit. So we want to make sure that their ventilation drive is not down, and we can tell sometimes by the waveform if they're coming out of sedation, and when that occurs, then we can start extubating them.
Okay.
Okay. Travis, as you see, it shows calculate sensor to 0 cell. So what we do with that is we take the end of the cable, which this is, then you put it on the 0 cell.
Okay.
There's one that says 0 cell,
Okay.
and there's one that says reference cell.
Okay.
So you're going to clip it in there until it snaps. Okay, the CO2 is ready to be calibrated. So we're going to go up to CO2, and we're going to click, and we're going to go over, we're going to make sure on the mainstream setup, pump is off. Going to go down to calculate to 0 cell. And then you push ready. and we wait for a number to come up. And it takes just a few seconds. When it flips like that, you can go ahead and start going down to calibrate the adapter, and you click again, ready, and then it's going to tell you it's ready.
Okay.
Sit down. Okay, so you're going to take this off. You're going to take your analyzer adapter. There are two different types. The black one is a permanent adapter, and then there are clear ones that are disposable. Okay? We've got the permanent one, so we'll have to properly wash that one when we get done. But you take this, and there's a white arrow here, and then there's a white arrow here.
Oh, okay.
Okay, so you would just snap that in. Okay? And then we're going to get ready to attach it to the patient. And now we're going to attach the analyzer to the ET tube and ventilator. And you want to make sure that you have it all ready to go so we don't lose any ventilation. You would attach the larger tube to the ET tube and the smaller tube to the circuit. So you want to hold on to the ET tube for security and detach, and then hook the larger tube up and the smaller tube to the circuit. And then you're ready to analyze. Travis, do you have any questions about how to hook that up?
No.